once women get to 42, 43, the success rate really plummets. So it's reasonably good up until 40, 41, but after that, it really, the live birth rate really goes down. And part of that is because the eggs are older. We're born with our eggs, so if we're 40, our eggs are 40 years old, and they're just not as good quality. So they're less likely to lead to a pregnancy, and if they do, that pregnancy is more likely to lead to a miscarriage. But there is hope, and there are good things happening. So there are things that we can do that help this situation. So donor eggs is one thing that's kind of become very much more used in the last 10 years or so. And this is where women who don't have eggs or who have missed the opportunity, haven't had the opportunity to get pregnant when they were younger, can do IVF with donor eggs, where they get eggs from a younger woman. And because these are younger eggs, they're more fertile, and there's a low miscarriage rate. And donor egg IVF can be really successful, and lots of Irish couples do it, and very successfully. There is a lot around the genetics, because the child won't be genetically yours, and for that reason it's very important that people have counselling and discuss in advance how they're going to deal with that, and particularly how they're going to deal with it with their child. Ovarian reserve is something you may have heard of, and AMH testing, and again this is fairly recent, but we know that women are born with their eggs. We have about 1 million eggs when we're born, and they're all gone by the time we reach menopause. Some women lose their eggs faster than other women, and we sometimes see women in their early 30s who have hardly any eggs left. And ovarian reserve testing is a way of picking up those women so that they know about that and can do something about it before it's too late. But an important thing to remember is that AMH, which is the blood test that gives us an indication of how many eggs, only tells us about the number of eggs, and the quality of those eggs is related to the woman's age. So even if you've got a really good AMH at 42, your eggs aren't going to be good quality, even though you have a lot of them. Another way of circumventing that is by egg freezing, and again, this is something that has come in recently, and it involves doing the first half of an IVF cycle, stimulating the woman's ovaries, and then getting the eggs from her ovaries and freezing them, and then doing IVF with them at a later date when she is ready to become pregnant. And because, again, they're younger eggs, the success rate is higher. But it's not a panacea for all the age-related problems, because frozen eggs are not as successful as fresh eggs, and IVF is not as successful as natural pregnancy if you try it when you're younger. Freezing eggs is also expensive, and it commits you to doing IVF both when you're collecting the eggs and when you go to use them in the future. And if we can avoid needing medical treatment, that's probably the best option.